The cancer diagnosis is very traumatic. When I was told I had anal cancer, yes, it was traumatic. My first talk with the oncologist was talking to me about the colostomy bag, and that sent my head reeling.
I'd like to thank my AIN team for the care and kindness and respect with which they treated me. No question was too trivial for them to answer, and they took seriously all my concerns and complaints.
I got introduced to my doctor here in New York, Dr. Stephen Goldstone, and that was the greatest gift anyone could have given me. He is not only a great funny guy with a wonderful bedside manner and incredibly easy to talk to, but he also uses what is called an endoscopy and was able to check the extent of the cancer that I had, at least on the surface, in order to give me a clue of what to expect in surgery. After the surgery, he followed up with me several times, and I was lucky that we decided I did not need to do chemo and radiation. We had caught it early enough.
First, I would tell them they need to inform patients more. From my biopsy to my radiation and my chemo, it took weeks and weeks. Although my cancer was stage 1, by the time it took them to confirm it, it was months of nothing but anxiety. I would tell them to show a little more compassion. There was one radiologist who took the time to comfort me. She listened to me. She even gave me a brochure about a meeting that was going on, although it was no longer in attendance, but she tried. I would tell them to educate more. My recovery took longer than the treatment itself. I wish the doctors would inform me of that at least, or at least let me know how things was going, or if something was wrong. My medical care was excellent. The emotional support, I could have used a little more of that. It would have made the journey a little less stressful from beginning to end.
I'd like them and the public to know that radical chemoradiotherapy affects every area of your life, not just your anus, so that social life becomes really difficult and interacting with the world in general is a huge effort.
Hi, I'm here to talk about gynecologists screening for anal cancer. They have many patients who come in and have HPV, but it's never suggested, strongly suggested, that they be screened for anal cancer. I myself, 35 years ago, had carcinoma in situ on the surface of my cervix. I had that taken care of and religiously went to my pap smear every 6 months. They had me do it. But never was it suggested to me that I should be screened for anal cancer. So this is what I'd like, that it should be strongly suggested, the same way a colonoscopy is strongly suggested, or a bone density test is strongly suggested.
First, the diagnosis of anal carcinoma is a life-changing experience for the patient. Being a physician myself, I poured through the literature immediately to learn more about the disease and alternative therapies. All research confirmed that radiation combined with chemotherapy was my best option. The portrait painted by my physician was a difficult therapeutic course with a great chance for a successful cure. The intense radiation I received, in view of my stage 3B cancer with nodal involvement, has left me with life-changing symptoms after 1 year. Following the completion of therapy, I have severe proctitis, tenesmus, I wear Depends, have urinary and bowel frequency, I never stray far from the facilities. I believe that these lingering effects were never fully elucidated by my doctors and have been work and life-changing experiences. I know as a physician, there always is a delicate balance between the encouragement and concern the physician must have with his or her patient. My advice to all care providers to anal cancer patients is to encourage them with the high rate of cure for the disease, but not underestimate the potential for the lingering and life-changing symptoms and anxiety associated with the treatment. Furthermore, the incomplete information currently available regarding the human papillomavirus in the body, even after chemo and radiation, leaves the patient in a suspended state. Further medical research and emotional support would be extremely helpful.
Because of the distinction between precancer and cancer, all of the cancer agencies don't provide support to people with pre-cancer. I think what I want to stress is that psychologically I find it really difficult living with anal pre-cancer.
I'd like to say to people, don't be embarrassed about the word anus. I could see you flinching when I told you I had anal cancer, and I could see in other people that when I experimented with the word bowel cancer, that it was a lot easier for people to handle. There is no embarrassment about having an anus, neither is there any moral judgment about it being infected with cancer. So please just treat it as you would any other cancer.
When I tell my friends what kind of cancer I had, and I mention anal cancer, they say, we know about colon cancer, but we never heard about anal cancer. And I find myself kind of suggesting that what they think is not why I got it. And I say it's because of HPV. That I don't have to be shy about. So there's an ignorance to it. And I would like it to be said more. Cervical cancer is like said all over the place, but not anal cancer. It's like, it's not for everybody.
That it's not a death sentence. It's totally curable and totally treatable, especially if you pay attention to your body, you know your body, and you take action early on. I had stage 2 anal cancer, which I was diagnosed with last September. I found this out through going to a gastroenterologist who did a digital rectal exam and found a small tumor in my anal canal. Then I had a sigmoidoscopy and a biopsy, and it was confirmed that I did have anal cancer. Unfortunately, I had to go through 6 weeks of radiation and oral chemotherapy, but I just got my clearance and I'm cancer-free. So what I really want to communicate to the world about having anal cancer is it's not something to be embarrassed about. It's not something to feel stigmatized about. This was HPV related. 85 to 90% of us have HPV. It's important not to be embarrassed because you could save somebody's life. This is a cancer that doesn't have to kill you, shouldn't kill you.
It's not having the cancer that gets you. It's about having how the cancer has to leave your body. It goes up through the anus, which is so excruciatingly awful. It's unreal. The only way I can actually equate it is like having an orange covered in razor blades. It hurts. It's awful. But however, better coming out the back than it is coming out the front. Trust me on that one. But once again, it's something you have to go through because they can't operate. But once it's done, and hopefully it'll be done quickly, but once it's done, it's done. That's about it.
It started off with warts shortly after I was diagnosed with HIV, and I had a few years of treatment for them inside and out, and then a clear spell of a couple of years.
Anal cancer and other HPV-related cancers are preventable. It is their responsibility to protect their children and get them vaccinated against anal cancer and other HPV-related cancers before they become sexually active. The treatment for anal cancer and other HPV-related cancers is brutal. I hope that they can say yes to their adult children when they're asked, was I vaccinated against anal cancer and other HPV-related cancers? That I have anal cancer, I am a parent, and I have vaccinated my children.
Women need to be checked more often. The source of the cancer apparently is HPV. And that makes a lot of sense to me because I've had a couple of abnormal paps. And if I had known that it could travel from the front to the back, I might have gotten checked earlier. And I actually recommend a routine check for women as well. I'm not sure why we don't check that part. The other thing I recommend is the vaccine. I got it even though it's probably too late to really have an effect on me. I think everyone should get it, all the, at least young ladies and men who are headed out into the world. I highly recommend the vaccine. Now, having gone through all this and having come out the other end, so to speak, I can tell you there are a lot of good jokes in this field. Mm-hmm. So after my surgery, I like to say, now I'm a little bit less of an asshole.